as a nation, will pledge to fulfill our responsibilities to our veterans, because our commitment to our veterans is a sacred trust, and upholding that trust is a moral obligation.
When Johnny comes marching home again, hurrah, hurrah, we'll give him a hearty welcome then, hurrah, hurrah.
With Secretary Rick Shinseki in the lead, we're building a 21st century VA. We're harnessing technologies to cut the red tape and backlog. Our nation's commitment to our veterans, to you and your families, is a sacred trust. And to me and my administration, upholding that trust is a moral obligation. It's not just politics. Thanks to advanced appropriations, the delays for funding of veterans' medical care are over. No veteran should have to wait months or years for the benefits that you've earned, so we will continue to attack the claims backlog. We won't let up.
Imagine you're a son or daughter. You raise them, you love them and protect them, and they volunteer to fight for us. And yet when they come home, they are left to die by the very country to which they gave so much.
The Department of Veterans Affairs Medical Center in Phoenix apparently kept 2 sets of books to hide a giant backlog. It looked good on paper, but the results were deadly.
We don't actually know what the people on the list died of because we never got a chance to see them or examine them.
Veterans left to die while waiting to see a doctor in VA hospitals, while the hospital officials pocket bonuses alleging that they reduce the patient wait times.
Why would these officials get bonuses so shortly after preventable deaths occurred in their hospital?
Well, I would just say anytime there is an unexpected death, you know, I put myself in the shoes of a family that has to deal with that.
But are you saying that you looked at these instances and on balance thought that the officials deserved the bonuses that they got?
We go back and look at every one of these and try to understand how we could have done it better.
Fact, the VA budget, $153.8 billion, has increased disproportionately above and beyond the increase in the number of veterans. Fact, every day, 22 veterans, men and women, kill themselves, many of them seeking VA help, which never comes. For the last 5 years, official reports show VA schedulers are not following policy. Electronic wait lists purposely omit the names of those who died. Fact, the names of at least 17 and up to 40 veterans who died were put on a fake list in Phoenix. Fact, whistleblowers nationwide confirmed that the VA deaths connected to a refusal to even schedule an appointment have occurred. And this week, VA Secretary General Eric Shinseki had the unmitigated gall to tell senators he was advised to not provide information that would compromise yet another inquiry. Really? How many inquiries do we need, General, before you provide information or even do something? So forget oversight. Why not just take the fifth, like that learned Lois Lerner?
Any adverse incident like this makes me mad as hell.
You call veterans facing certain death refuse medical care by VA personnel who then create false records so that they can pocket a bonus an adverse incident? It's not an adverse incident, General. It's a homicide, a criminally negligent homicide. And oh, that political preparation.
And what I've committed to is whatever comes out of this, whatever is substantiated, actions will be taken. We will take actions.
Thank you, Secretary Shinseki, for a lifetime of service to our nation and for being such a tireless advocate on behalf of America's veterans.
Mr. President, your Secretary Shinseki actually said this before the Senate.
If any allegations are true, They're completely unacceptable.
Unacceptable? Huh? Where have I heard that one before?
As I said last night, it is just simply unacceptable. The suffering and bloodshed is outrageous, and it is unacceptable.
It's simply unacceptable. It's simply unacceptable.
Well, obviously, these reports, if they're true, are unacceptable.
Honoring this service and upholding these ideals requires more than saluting our veterans as they march by on Veterans Day or Memorial Day. It requires marching with them for the care and benefits they have earned. It requires standing shoulder to shoulder with our veterans and their families after the guns fall silent and the cameras are turned off. At a time when we're facing the largest homecoming since the Second World War, the true test of our patriotism is whether we will serve our returning heroes as well as they've served us.
CNN senior investigative correspondent Drew Griffin broke this story, has been tracking the fallout for the administration and the veterans caught in the middle. He joins us now for more. So Drew, Mr. Obama pledged that his administration would be different, but look at what happened.
Yeah, and it's very interesting to see how this is suddenly getting all the attention, Carol. We, of course, have been reporting this for 6 months, but I want to point out the VA's Inspector General reports have been out for years now detailing this problem with wait lists and denied care, which is why then Senator Obama made that pledge to the VFW back in 2007 that he was going to end these delays for care. And Deborah Draper, you know, the newest reporting out this morning, Carol, is that the VA's own wait list data is unreliable. That is not new either. The Government Accountability Office and the person in charge of that, Deborah Draper, has been reporting on these problems with the reliability of the data for a decade at the VA, which makes this sound we heard over the weekend about the president being mad just seem rather hollow. Take a look at what his chief of staff said on Sunday.
The president is madder than hell. And I've got the scars to prove it, given the briefings that I've given the president, the conversations that he and Rick and I have had on these matters. But at the same time that we're looking at accountability, we want to continue to perform to provide our veterans the services that they have earned.
Carol, quite frankly, if the president is truly mad as hell, he should be mad at himself and his staff for not only ignoring our reporting, but the government's own reporting that's showing this was a problem and, in fact, ignoring his own campaign promise of 7 years ago.
Drew Griffin reporting live from Washington. Thanks so much.
The spreading scandal of delayed care at Veterans Administration hospitals and the unraveling efforts to cover up the problem have resulted in predictable calls for the resignation of VA Secretary Eric Shinseki. But the VA has been plagued with patient backlogs for as long as I can remember, and the problem has defied all efforts to solve it. The fact is that long waits for care are common to government-run, taxpayer-funded health systems. Think of all the complaints you've read about long waits for care in the socialized medical systems in Britain and Canada. They are what happens when the government owns and operates the hospitals, pays the doctors and nurses, and finances it all out of a central budget. As Michael Tanner of the Cato Institute points out, the delays are simply a form of rationing. This is an inconvenient truth to those who believe in full-blown socialized medicine.
Is it possible that in some cases unrealistic expectations have created a situation where some staff is in fact cooking the books?
But it is also inconvenient to those who merely prefer a single-payer system where the government does not provide the care but does pay the bills. That's how Medicare works. It may be popular because it's supposedly free, but people who can afford it buy extra private insurance to cover its gaps. That's also how Medicaid works. It's free too, but good luck finding a doctor who will treat you. The number of physicians who take Medicaid has been declining for years, and a recent study of 15 major cities found fewer than half their doctors now treat Medicaid patients.
We've dramatically increased veterans' health care across the board.